Welcome to all the people who are joining us in the webinar number 179 since the Andean Health Organization Convenio Hipólito Unanue started the cycle of webinars in May 2020. It's already 3 years of ongoing interlearning. At the Andean Health Organization Hipólito Unanue Agreement, we promote health and wellness, as well as social and environmental justice. We firmly believe that the One Health approach is essential to achieve the highest possible level of health in our populations. Likewise, the COVID-19 pandemic also teaches us that the capacities built and strengthened must not be rolled back, and health must remain at the forefront of our policies. Research, epidemiological and genomic surveillance, vaccine and drug development, and the deployment of health promotion and prevention measures are essential for a caring society. Reflections on these and other priorities relevant to health and well-being can be found in the monthly Noti Salud Andinas newsletter, available on the Andean Health Organization's website. We invite you to leave your name, organization, and country in the comment box of the Facebook live chat or YouTube live. In that same space, you can leave your questions or send them via email to webinarhorasconu@gmail.com. In this webinar, we will follow the usual dynamics. We will begin with the institutional greetings, followed by the presentations of our speakers, and then we will move on to the questions and answers round. To access the certificate of attendance, as usual, in any of the Facebook Live or YouTube live chats, you will find a fixed link where you must fill out a brief survey and leave your data as your email. And please verify that your email is correctly written for sending the certificate, which will be sent in the coming days to that same email address. To begin this important day, I will give the floor to Dr. Maria del Carmen Calle, Executive Secretary of the Andean Health Organization, who will give the welcome and institutional greeting. Go ahead, Dr. Calle. Thank you very much, Magda. Well, good morning, good afternoon to all of you. I would like to give you the warmest welcome today, July the 6th, to the 179 webinars since we started our cycle of webinars in May 2020. The topic that we decided to touch today is promoting childhood and early childhood development post-COVID, which is actually a challenge. I would like to thank very deeply the presence of our renowned professionals who are also experts on the subject matter that is gathering us today. Dr. Naveen Thakur, Chairman of the International Pediatric Association of India, Dr. Cecilia Rambauer, Director of Communities and Vice Director of this association in Virginia, and Dr. Givovich, who's a pediatrician who has a PhD in public health from the Peruvian University Cayetano Heredia. The topic that we have decided to touch today is of the highest relevance, as it is essential for the health of all people. And depending on how we manage to develop in childhood and how much we can develop our potential, we can achieve a better quality and opportunity of life. Early childhood development is a determining factor of the physical, mental, and social health of people. Ensuring the well-being of children is an essential condition for the states to comply with the 2030 agenda and making the SDGs a reality. It's a commitment to a social and political model that puts children, especially the most vulnerable, at the center. The 2030 agenda represents a great opportunity for the Andean countries to respond effectively to the fight against poverty, inequality, and also in favor of sustainability. There are different studies that tackle the importance of investing in early childhood, as the experiences and learning to take place during this critical period of human life largely determine future development. However, due to the situation of poverty and vulnerability in which many Latin American families live, many children do not receive the care, the nutrition, health, and safety and nurturing they need to develop to their fullest potential. The COVID-19 pandemic will certainly increase the vulnerability of young children, and even more than ever, efforts to promote holistic early childhood development and sustain the region's achievements in this area are critical. The experiences throughout the first years of life, the quality of interactions, and the conditions of the environment where children and families develop and move through are key to breaking the intergenerational cycle of poverty and the promotion of economic productivity and elimination of social disparities and inequalities. The signing of the International Convention on the Rights of Children in 1989 and its ratification by the member countries of the United Nations showed an important milestone in the history of humanity. The signatory countries assumed this responsibility of formulating and designing action plans in favor of children. It is under this context that Latin America was actually no stranger to the social agenda in favor of children. Each country initiated a process of construction and implementation of policies and programs aimed at children, each with a diversity of nuances and approaches in different political contexts, with the participation of different actors, level of government, institutions, and sectors of the state, as well as emerging priorities according to the governments in power. In 2022, we have turned 33 years of this convention. It is therefore necessary to look back to know what has changed, as well as what is still needed. We must reflect on the current situation of diverse children and how policy instruments are being effective in contributing to their full development. The health organization has been working in favor of the well-being of children, and part of this work throughout 2022 has been prioritized as part of the scheduled activities in the annual operational plan. Preparing the technical document and identification of the current situation of children's health and the policies that are necessary. Also, plans and interventions that contribute to the optimal interventions in the Andean countries. This meant actually hard work which had the collaboration, participation of the Andean task force made up by the focal points and experts in children's health from the ministries of health of the 6 Andean countries that you know is Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela. And today we will have the chance to learn from Dr. Gibovich's presentation. Children need to start living in the best way possible. Their survival, protection, growth, and development with a very good health and adequate nutrition, their education in safe environments, and the education that they'll also need are the mainstays of human development. And this is why that from very long we have said that children, boys and girls and adolescents are not the future. They are the present, because from the positive actions or negative actions that we undertake, their future will count. Not only their future, but our nation's future. We reiterate our thanks for your participation today. Thank you very much, Dr. Carmen, Mari Carmen Calle, for your opening words. So, today, to start this webinar promoting early childhood development in post-COVID-19 times, a challenge for children's rights, we have developed this webinar given the high relevance of this topic to be able to take a look, and this has been mentioned by Dr. Calle, which is actually a determining factor of the physical, mental, and social health of the people. So to talk about it, we have three leading medical experts in the subject matter of therapy. This preamble, we would like to welcome Dr. Guillermo Gibovich, who will present the current situation of child health and the policies, plans, and interventions that contribute to the achievement of optimal early childhood development in the Andean countries, which is a result of a study conducted by Dr. Gibovich together with the Andean Working Group on Child Health of Horas CONU in 2022. Dr. Gibovich is a medical doctor, graduated from Universidad Peruana Cayetano Heredia with a specialty in pediatrics and a master's in public health from that same university. He also holds a PhD in public health from Universidad Peruana Cayetano Heredia, a diploma degree in epidemiology and biostatistics from Johns Hopkins Bloomberg School of Public Health, Baltimore, the United States of America. He has studies in the Laureate Higher Education Certificate Program from 2017 to 2018. From 2000 to 2003, he's been the National Consultant in Epidemiology by Pan American Health Organization, PAHO, in Peru. From 2003 to 2014, he was International Advisor in Epidemiology, Information Systems, Knowledge Management, and Prevention and Control of Communicable and Non-Communicable Diseases by the Pan American Health Organization as well, but this time in Honduras, Venezuela, and Colombia. From 2014 to 2015, he was the advisor to the Vice Ministry's Office of Health Benefits and Assurance of the Ministry of Health of Peru. From 2014 to the present time, he's been acting as a professor of the Public Health and Health Services Management line of the Faculty of Health Services, School of Medicine at the Peruvian University of Applied Sciences in Lima, Peru. He has several publications, and among the last ones, we have the basic guidelines for mortality analysis, PAHO 2017, and another in the Pan American Health Organization guidelines for surveillance of Zika virus disease and its complications. That's May 2015. Go ahead, dear Dr. Givovich. The space is yours now. I think the doctor is muted. We're having some technical issues here.
Guillermo, no te escuchamos. No te escuchamos.
I'm sorry. Before starting, thank you very much for the invitation for this important webinar. And I was saying that I will give a very tight presentation on what will soon be a publication from Orasconu on this work that we have developed last year. There are three topics that I will briefly present. An introduction on early childhood development, a micro-conceptual framework in the Andean countries, some indicators on the development of boys and girls in Andean countries, and to finish up, the state of the policies, plans, and interventions in our countries. Starting with a conceptual framework on early childhood development. What we currently have in our countries is actually a variety of definitions in each one of our countries of what's this about, apart from the denomination itself. What's the scope in terms of the ages and the coverage of the activities or approach, which is also varied, and the indicators to measure the progress of the different countries, which is absolutely varied as well. Something that we might prove, if you will, is that at least all of the strategies and programs and policies related to early children development in the Andean countries include boys and girls under 5 years of age, includes health and nutrition as aspects to consider, development of perceptive and cognitive and motor skills and self-regulation skills. Some countries have focused more on some rather than others, but some way or another, they have also all of them being considered. However, not all of them are including aspects related to teenagers and discipline, use of violence as strategies for discipline, and result indicators, because most of our countries are working with process indicators. In the past years, there was a new conceptual framework coming about, which is a careful and sensitive look. This is actually a new conceptual framework. This is how it's been considered for countries to have a roadmap to work under. We think that it is important to share this new framework because it could be a good way of channeling our actions, especially in this new stage where we are preparing an Andean policy on early childhood development. This careful and sensitive care will ensure good nutrition, good health, protect children from threats, and considers the optimal development as a result of multiple stage interventions. And I think that this is consequent with all the definitions and those which have been proposed so far. It has indeed some fundamental components: having good health, adequate nutrition, receptive attention, opportunities for early learning, protection, and security. But when when we mention good health, it's bef before birth until adolescence. It's not only boys and girls. How are our countries doing in terms of health and development of boys and girls? Well, the presentation will be a short one, and I've based these concepts, and I want to present the risk factors which have been mentioned in the Lancet series by Walker et al. I will present these risk factors briefly for adverse outcomes in developing countries, and then some indicators of this new proposal of caring and sensitive raising of boys and girls. It's being translated by PAHO in 2021. Almost all slides have included the reference. The indicator itself has been mentioned. This is, well, they actually say that this is the best country to have children, which is Norway. So that you can take a look at the gap, actual gap. The neonatal and childhood mortality, if it's true, it's been dropping in the last decades, it still has worrying levels. Some are extreme in some countries, in others it's actually reduced, as in Chile. But anyways, we could do much more, way much more. Now, regarding the diseases that are contributing to this reality, to this mortality, we have diarrheal infections or diseases in children, and we still have a problem. Well, actually, this is still an important problem in many of our countries, with levels which are much higher than others, as well as pneumonia. As you can see here, there are differences in terms of death by pneumonia in children less than 1 years of age and 1 to 4, especially those children less than 1 year are contributing the most to these mortality rates. In this publication, which is soon to be published, we allowed ourselves to include this indicator that we believe deserves some degree of follow-up in the coming years, which is orphan children and death of their caretakers. As you know, COVID-19 caused a lot of death of caretakers, caregivers, and we can appreciate that the figures of orphans, the boys, girls, and adolescents has dramatic values, and this could have also very serious repercussions in their future development. Now, going to the risk factors themselves, which I mentioned at the beginning of this part, that are absolutely relevant to the future development of children. We have poverty. There's no doubt that poverty has a lot to do with early children development, and some say that it can even go up to adolescence and even beyond. Poverty, which has been decreasing in some countries before and during the pandemic, got worse. The figures increased, and despite in 2021 they decreased, they have not come back to pre-COVID values, and hence the variety between the Andean countries that you can see here. Some countries have a low level and some others have a very high level. Another risk factor is the vaccine protection. This is the third dose of pneumococcal vaccine in 2019, 20, and 21, where we started to have and to see a drop in coverage, which was low already, but given the COVID-19 pandemic, this got worse. Some countries have recovered their previous values, but still this coverage is actually pretty low. Another risk factor that was indicated as important for the future development of boys and girls is the low birth weight. These are important figures in the Andean countries, especially values that are close to 10%, and figures which have not varied significantly since 2017. The delay in growth, I'm sorry, but this is a mistake. There's there's a mistake. These are We see that for some countries this is markedly high. There's a lot of variety, variability in these values. We have countries with pretty high values. And anemia, as we and you know, anemia is actually a very important health problem in our countries. All of the countries, if we apply the categorization of the World Health Organization to know when this is actually a health problem, all of our countries will fall into this category because it's actually pretty high. A protective factor which also has an important relevance in child's development. In some countries, we've been having a decrease in maternal breastfeeding, and you can see how in Bolivia and Colombia, we couldn't obtain better figures, but the values are not those which are ideal. They are far from ideal, actually, and this is still something that could be much worse for Peru. When we analyze the inequalities in exclusive breastfeeding, it goes from 80% in some social strata, especially the poor one, to 20 in those who have better social and economical levels. Some characteristics of the health system, and this is something that affects the whole country. All deliveries which have been served institutionally, they are close to 100%. However, the prenatal in the first 3 months is absolutely essential for the evolution of the pregnancy and the progression of the pregnancy. There are no similar values. There is a huge gap, we could say. And this is something that we need
Y
to
un problema
bridge.
que nos
And a
preocupa
problem which is actually very
particularmente a Latinoamérica
concerning for Latin America
y el Caribe
and
es
for the
que somos el
Caribbean.
gobierno del
Well,
mundo con
these are supposed
una
to
reproducción
be
adolescente más
the
alta o de las más altas,
regions with the highest level of
lamentablemente esos valores suben
fecundity,
muy alto. Entonces eso hay
and
que
this
diferenciar
is
del resto.
actually a very
Tienen
important
altos
factor in
valores
Chile
de
and um, in the other countries of fertility.
anemia en gestantes también, sí, también, como la anemia en niños y niñas,
As
la anemia en gestantes también tiene un significado importante como problema.
anemia in
Bueno,
pregnant women is also something to consider.
esta
We see that there are values
protege
over
todos los niños,
20% in almost
25%
all,
de
and
niños y
in
niñas.
some cases it's 35%.
Y si ya nos movemos hacia el lado
If
izquierdo,
we go
hay otras
further
condiciones que pueden marcar la
on
salud
to
y
see
han
what's other conditions
puesto
that could show us
en
some
particular
path,
hoy en los niños, está el estreñimiento
especially
craniano.
dealing with the water and
Esta
sanitation.
salvedad
We
que
have
estas cifras
to
son del
mention
Departamento
that
de
these
Organización de las
figures
Naciones y
come
UNICEF,
from the
que no mide, como no
joint
mide niños en
monitoring
cuanto a
by
situación
UNICEF
de
and
pobreza,
WHO, which could be markedly
cifras puede
different,
ser diferentes, pero queremos
but
señalar que
we want to indicate that
también
there is
normalmente
actually
en países
a
una
very
brecha
important
enorme entre
variation
ser
and a
un
huge
país anémico.
gap to
Vamos
bridge
en
from the
crecimiento, la
sanitation
situación es
viewpoint.
peor.
The water and sanitation reality is much worse in some of our
En cuanto a
countries.
indicadores ya del
Now,
cuidado
regarding
cardiovascular, está en marco conceptual
other
que mencionaba al
indicators,
inicio.
we have the conceptual framework that I
Este,
mentioned a while
este marco
ago.
conceptual lo
Well,
propone,
this
además de
is
estos indicadores
apart from
de salud y
the
nutrición ya
health and
observados,
nutrition
propone medir
indicators that I've been
puntualmente estos
presenting,
tres
it proposes to
elementos y
measure
establecer oportunidades para
these
reproducción
three
temprano
components.
y seguridad y protección. Sin embargo, cuando hemos
However, when
recopilado
we have
estos
been
indicadores,
compiling
pues hay
these
una variedad
indicators,
en sus
there's a great
definiciones,
deal of
sus
variety in the
especificaciones
definitions and
y por eso está
conceptualization.
reflejado
It's
en la
actually
política
very
de desarrollo
difficult
del
to
Estado.
present
No hemos
the
particularizado
situation
cada
in the
país
Andean
a otro,
reality. We didn't want to mention one
entonces
country over
se
another.
realiza la
Particularly,
publicación
we
de
want you to take a
porcentajes
look at these
cada país está presentado
figures
país por país como está.
where we
Algunos
have
no
indeed included
aparecen
some of these
no pueden
indicators
ser
country by country, but we cannot do
comparaciones por
this
la diversidad de
type
las
of
definiciones.
comparison right now because there are
Y
diverse
por último,
definitions to take into
en este
account.
trabajo del año pasado,
Now,
luego
regarding this
de
work
salud,
that goes back to
miramos
last year, we've taken a
cómo las
look
políticas, planes y
at
programas
the
relacionados con el
plans
desarrollo
and
temprano
programs
en los
regarding
países andinos.
early childhood
Esta
development in the Andean
tercera
countries.
salvedad, que no quisiéramos
And
llamarle
we
evaluación,
don't want to
no
call
fue
this
evaluación, sino fue
an assessment.
una
It
revisión,
was not
nos permitirá
an
ver
evaluation. It was actually more of a
cómo se
review,
hacen
if you will. We wanted to analyze
los atributos
its
de
the
estas políticas y
attributes of
programas
these policies or
gubernamentales
programs and
respecto
plans
a algunas características en su
regarding
formulación y
some of
algunos
the
puntos a
characteristics in
mejorar,
their formulation.
objetivos, metas, si había una estructura
We
nacional
wanted to realize if there
específicamente
was a
responsable tomando en
multi-sectoral
cuenta las políticas
approach,
sectoriales,
if
además de
there
esa
are
evidencia
other
e investigaciones.
evidence is
Hablaba de
being
alineado
taken
con
into
iniciativas de
account and
desarrollo
if it was aligned
y desde el punto de vista
with
de
global
evaluación,
initiatives. And from the
esta
evaluation
evaluación regular
perspective, if
basada
there
en la
were
evaluación de sus resultados
regular assessments
propuestos
of this,
y
of
si estas
course,
habían representado cambios
and if
institucionales
they
y en las metas.
represented institutional changes and
Esto
changes in the
permitió
standards.
encontrar un análisis de coherencia
We
entre los objetivos de
added a
de las
consistency
políticas sociales
analysis
y
within these
los
plans
anteriores
and
indicadores
programs and
que
the
habíamos presentado país por país.
situation analysis that we had presented country by country. We identified 46
Que
of
estaban
them,
vigentes, o sea, que estaban
46
vigentes
documents,
todos los
policies,
elementos
plans,
que se
and
habían señalado
programs,
en la
which were
no
actually
estaban
being applied.
siendo operacionalizadas en los países, sino que estaban vigentes.
They were. And being applied in the
Estas
countries.
46 tenían
Now,
algo
these
relacionado con la
46
representatividad.
had
Tenían
objectives
metas e indicadores
and,
específicos para
and
representarse en los
indicators and
órganos.
specific
Todos
goals.
contaban con una estructura
All of them
organizativa
had
consolidada y una
a
visión siempre
organizational
diferente.
structure.
Consideraban la mayoría de ellas las políticas
Most of
nacionales de
them
desarrollo
considered
como
national
seguimiento de la
policies for
planificación asistencial
development.
para
There
alinearla con las estrategias
was
sanitarias
evidence to align
de
them with
las
the health
naciones al
strategies of
desarrollo
the
o
Americas or even
estrategias
world
globales.
strategies.
Sin embargo,
However,
muy pocas se pudo identificar
in
evaluaciones
just a
periódicas.
few, we were
Informes
able
y
to
publicaciones
identify
regulares
regular
establecidas que
evaluations
detectaban
and
un flujo de
reports and
resultados
publications, and
significativo
whether
en el
these
crecimiento
results
económico.
actually were translated
Hay que
into
señalar que
changes. We have to
de estos
indicate that
46, en realidad no se
some
identificó
some
Chile
few
Crece
of them that
Contigo o el
we
programa
identified, like Chile Crece Contigo or
presupuestal
the
del Perú,
budget program
del
of
Fondo
Peru and
Monetario. Otros
some
países sí
of other
hacían
countries,
evaluaciones y presentaban resultados, pero esto no era
but
lo regular.
this was not something that regularly
En
happened.
conclusión,
So, in conclusion,
los resultados en salud
the
se han mejorado en los países andinos,
results in terms of the health
estamos
of the
revisando
Andean
desde las
countries,
economías,
it's boys and
pero
girls,
persisten todavía
but
significativas brechas en cuanto a
there are
mortalidad
still
sanitaria
important gaps
y
in
el cuidado,
mortality
empeorando con
and
el COVID-19.
morbidity. And some of these even
La
got
mayoría de
worse
factores
with
de riesgo
COVID-19.
asociados al versus los
Most of
objetivos
the risk
establecidos mantienen
factors
importantes brechas
have
y
kept
algunos,
important
cabe señalar, pobreza y
gaps,
vacunación,
and
empeoraron con el
some
COVID-19
of
y
them
no se
got
recuperaron.
worse with
Cabe
COVID-19
señalar el
and they
año
have not recovered.
2021-22.
But I
Debido a
mean
esto,
2022
no es posible
mostly.
todavía elaborar un cuadro de mando
We
universal de
cannot
cuidado cariñoso y sensible para los países
prepare
andinos, aunque algunos
a chart for
indicadores
Andean countries
parecidos
under this new
podríamos hacer un
context,
trabajo ahí
but
con
we
mayor
could
especificación de los
we could
indicadores.
start working on this
Por
indicator
último,
soon.
los países cuentan con
And
políticas,
last,
planes y
the
programas de
countries
atención
have
hacia el
policies and
envejecimiento
plans
más
related
acciones
to these
para su
issues, but
seguimiento y
there's
crecimiento
much
de los
needed
mismos también.
for
Muchas
the
gracias por
follow-up,
todo
for
en esta
especially
presentación.
results in early children's
Es todo.
development.
Gracias por la atención. Esta era una
Well,
breve
thank you
presentación
very
de lo que
much.
se
This
quería
is
decir.
what I wanted to present today before all of you.
Muchas gracias, doctor
Thank
Guillermo.
you very much, Doctor.
El doctor Guillermo
Now,
nos ha
Dr.
aportado
Guillermo has
aspectos
presented
diferentes, definiciones, alcances, coberturas e
on the
indicadores para
different
establecer
definitions, scopes, coverage, and
indicadores para
indicators to
estudiar
talk
cada
about
país
and measure early
cómo
childhood
tiene que
development in the
evaluar a los
countries of the
países
world.
andinos. Y eso se ha evidenciado en el estudio que se ha
This
desarrollado
has become
en
evident in the study that was
2022.
developed in
Es importante
2022. It is
señalar
important
que su
to point
definición
out
incluye
that
a
their
bebés de
definition
5
includes
años
children under
y
5
áreas
years of
de
age
nutrición,
in
desarrollo
health,
habilidades
nutrition, development of
cognitivas,
perceptual, motor,
áreas
cognitive,
participativas y
language,
emocionales y de
social and
comunicación.
emotional and
En algunos
self-regulation
países no
skills. But in some
incluye la
countries,
definición
this
internacional
definition does not
de
include
tantas como
interventions in
escolares,
pregnancy, in
de violencia,
school, and
disciplina.
violence and
Hemos hablado
discipline.
también del cariño,
He has
del
also
gobierno
spoken of
responsivo
loving and
como nuevo
responsive
marco
care as a
conceptual
new
para la
conceptual
salud,
framework
que
for
tiene como
action,
componente lograr una
which
buena salud,
components are to
el
achieve good
adecuado
health,
acceso,
adequate nutrition,
oportunidades para la
responsive
realización de
care,
prácticas
early
saludables
learning
y seguridad
opportunities,
de
and child
alimentos.
safety and security.
Por otra parte,
On the
también
other
está
hand, he has
analizando a detalle
mentioned
datos en la
uh,
recomendación
now
de este
dealing with
estudio,
the
algunos
findings,
importantes factores de
some
riesgo e
important
indicadores de
risk
salud infantil en
factors
los países
and
andinos, como la mortalidad
like
neonatal,
neonatal
que ha
mortality,
venido
which
disminuyendo, ¿no? Aún sigue
is has
siendo
been dropping. It is
un
still
problema muy
high
importante
and a very important
por sus altos
problem
índices si
because
lo
of its high
comparamos
indices.
con
If we compare
experiencias que nos ha
this
dado
with
para
the
los
reference
indicadores,
framework that he has given and shared with
desde el
us
país de Noruega, que es considerado uno de los
in Norway,
países
which is
mejores
considered
para el
one of
cuidado
the
de
best
niños, ¿no?
countries
Y
for
en ese
raising
sentido es
kids.
preocupante
And
todavía las altas cifras que
the
tenemos
high
de
figures
mortalidad.
of mortality are
Y está muy
still
alto en Venezuela y
very
Bolivia y
concerning.
el de menor
It's higher
mortalidad
in
en
Venezuela
Argentina.
and Bolivia, and
También
Chile
quizá
shows the lowest mortality.
revisado lo que significa
He
la
has
mortalidad por
revised
diarrea, por
diarrheal
neumonías en
mortality,
niños, ¿no?
pneumonia
Mucha
mortality, which
bajo
is
tasa,
strikingly
la
high
brecha
in
grande
Venezuela
exponencial, esa gran brecha
compared
comparando
to
con nuestro
the
país
very
de
low
referencia.
figures in
Se ha
Chile.
evidenciado
This is actually
El
something that
antecedente también antes de la pandemia, los índices de pobreza,
he showed.
cómo el año 2020 por esta pandemia
And
se ha vuelto a incrementar en todos los
likewise, there is
países.
evidence of an
Colombia
increase in
por
poverty
tanto,
rates for the year 2020 in the face of COVID-19,
quizás
with
el
Colombia
país
being
más
the
alto
country with the
índice de
highest
los
rates in
últimos
recent
años entre las
years.
referencias
There
colombianas.
are no data from
Las
Venezuela.
inmunizaciones preocupantes
Immunizations are also of
bajas
concern due
en
to the low
efectividad
coverage that has
demostrada
occurred
también
during
ya no
the
vamos
year
mucho en algunos
2020,
países y con la
which
pandemia esto
has
se
just
agrava.
been recovered.
Se ha podido también revisar indicadores
Other
importantísimos en la salud,
indicators, which are
la pobreza, el
important,
retraso,
have
datos
been
demográficos, retrasos
revised,
en crecimiento,
such as low
anemia,
birth weight, stunting, and
los
anemia,
denominadores que
where the
continúan
common
se manifestando
denominator
en
is
las
that they
muertes,
continue being
Y
very high
también
compared to
revisando
those
la
found in
situación de
high-income
importantes
countries.
indicadores en la salud de las
And there are
mujeres, como
other
los predicados
indicators
al parto y
being
anemia
reviewed for
constante en
pregnant
pacientes que
women, such
estando
as
muy por
prenatal care and
debajo
childbirth and
del país
anemia
de
rates in
referencia.
pregnant women, all
En
Andean
este
countries with
documento
rates
técnico,
well above
como nos
those
dice el doctor
of
Guidovich,
high-income countries.
también se ha revisado
In this technical
las
document,
políticas, los planes y
the policies,
programas
plans,
que
and
se han
programs
desarrollado
related to early
en los
childhood
últimos años
development that are
implementando en
being
los
implemented
países,
in the Andean countries
siendo importante
have
remarcar
been
que si bien
reviewed.
existen
If
importantes
it's true, there
avances
are
y
still
procedimientos,
important policies and technical
mayormente no
documents
pueden
being
identificar
implemented.
evaluaciones
Most of them could not
regulares
identify
o
regular evaluations, reports,
publicaciones de
and
los resultados.
publications of results,
Y si estos
and if these
resultados deben
results
ser
produced
evaluables
institutional
según las
changes
instituciones y
or
normas.
other
Algunos
standards.
casos, ejemplos nos ha dado el
Some
doctor como el de Chile contigo,
examples
el de
are Chile
proyecto consorciado en
Contigo,
Perú,
the
pero
Peruvian
no
model
es
as
el de
well,
la
but
mayoría.
this is not that of
También,
most of the
doctor Laureano
countries.
Givovich, reiteramos el agradecimiento
Dr.
por la
Givovich, we
excelente
reiterate our thanks
disertación.
for the excellent
Nos han
lecture.
llegado
We have
muchas
received many
felicitaciones y
congratulations and
preguntas.
questions,
Lo invitamos
and
a
we
seguir
invite you
en
to
el
remain in
salón.
the
Al
room.
final de las
And at the end of the
presentaciones realizaremos
presentations,
un
we will
diálogo a
conduct a
partir de
dialogue
las
based on the
preguntas
questions
generadas.
generated.
Ahora le damos la
Now, we would
más
like to
cordial
welcome
bienvenida al doctor Naveen
Dr.
Chakra,
Naveen
quien nos
Thacker,
expondrá el
who will
tema
present
titulado
on the
Comienzos
topic Caring and
Insensibles para
Sensitive
el
Care
Desarrollo
for Early
Infantil
Childhood
Temprano,
Development,
rol
the
de los
role of
pediatras.
pediatricians.
El doctor Tucker
Dr.
es
Thacker
presidente de
is
la
president of
International
the
Pediatric
International
Association
Pediatric
en
Association
India,
in India,
director del Deep Children Hospital
director
and
of the Deep
Research
Children
Center
Hospital
at
and Research Center
Gandhiham
at
Kuch,
Gandhinham
Gujarat,
Kuch,
India,
Gujarat, India,
y profesor
and an
emérito de
associate
pediatría
professor of
en
pediatrics at
Pramukshwami Medical College,
Pramukhwami Medical College
Karamsad
in
Anand,
Karamsad,
Gujarat,
Anand,
India.
Gujarat, India.
Secretario de la Fundación para
Secretary
la
of the
Salud
Child
Infantil
Health
en la India.
Foundation in
Es
India. He's
expresidente de
past
la
president of
Asociación
the
de
Asia
Pediatría de
Pacific
Asia
Pediatric
Pacífico
Association
para el año
for
2016-2017
2016-2018
y
and
presidente
national
nacional
president
de
of
la Academia
Indian
Indiana de
Academy of
Pediatría del año
Pediatrics
2007.
in
Pertenece al grupo
2007.
asesor de expertos del gobierno de
He's
Gujarat y
an
India sobre sarampión,
expert
rubiola
advisor
al
to the
Ministerio de
government of
Salud
Gujarat and India
y
on measles
Desarrollo
and
Social del
rubella from
gobierno
the
de
Ministry
India.
of Health and Family Welfare.
Completó
He
la
has completed
formación
the advanced
en
vaccinology
curso de
course
vaccinología
training
avanzado
in
en
Annecy in
Infancia del
France at the
Instituto
Institut Pasteur
Pasteur Mérieux
Mérieux.
en 2007. Miembro del Comité
He is member of
Permanente
the
de la
standing
Asociación
member
Internacional
committee
de
of the International
Pediatría en
Pediatric
2007 y el
Association
2006.
2007 to 2010,
Presidente del Comité de
co-chairman
Inmunización de la
of the
Academia India de
Immunization
Pediatría
Committee, Indian Academy of
en los años
Pediatrics from
2010 y
2009 to
coordinador
2010,
nacional del
national
Programa de
coordinator of the Newborn
Afirmación de la
Resuscitation
Atención
and Basic
Básica del
Newborn
Recién
Care
Nacido,
Program of
Proyecto
Golden
Niños
First Minute
Minuto
Project,
Dorado. Miembro
member
del Comité de
of the Immunization
Inmunización de
Committee,
la
International
Sociedad
Pediatric
Internacional de
Association,
la Asociación Internacional de Pediatría y asesor
International
científico
Scientific
internacional, miembro
Advisor
de la Junta Voces por las
of the
Vacunas,
Voices for
miembro
Vaccines,
del Comité
member of the
Asesor
Scientific Advisory
Científico
Committee of the
presidente
Enterovirus
del
Research
Peovirus
Center
Mumbai
in
y
Mumbai, in the
Consejo
Indian
Indio de
Council of
Investigación
Medical
Médica
Research
desde
from 2008
2010.
to 2010.
Tiene más de
He
50
also has over
publicaciones
50
sobre
publications on
vacunas e
vaccines and
inmunización en
immunization in
revistas
peer-indexed
indexadas
journals.
por pares.
His
Su
work on
trabajo
polio
es
eradication is
reconocido,
international recognized,
reconocido
and his
internacionalmente
related
y
articles
sus
have been
artículos
published in
relacionados con
index
el
journals
mismo
and
han
in
sido
press
publicados
including the New York Times, Time Asia, Wall Street Journal, The Time, The Hindu, the Wall Street Journal India, Dowser, and The National. He has been the recipient of some prestigious awards, including the Outstanding Asian Pediatrician Award 2012, Rotary International Regional Award for a Polio-Free World 2010. Go ahead, Dr. Naveen Thakur. The space is yours.
Thank you. Can you project my slides, please?
Yes.
Thank you. Just make it a slideshow mode. Yeah. So thank you so much, Magda, and my sincere thanks to Dr. Maria del Carmen, who is our in leadership position in International Pediatric Association, for this opportunity. And sorry for the poor connection here because weather is very bad, and I'm joining from my phone, and it's also 10:30 p.m. almost 10:30 p.m. in India. But it's a pleasure to join. So my topic is nurturing care for early childhood development, role of pediatrician. Next slide, please. And next slide. Next. Yeah. So as it has been already told that children in 43% children in lower and middle income countries are at the risk of not reaching their development potential because of poverty and stunting. And so the best first 2 years of life or 1,000 days are the most sensitive to the nutritive effect of child growth, cognition, and subsequent school alignment. And this is brain science behind early child development. Here you can see it is written 3 years. So first 2 to 3 years are most important. And we know that neural tube is start forming at 8 weeks of gestation. And during late pregnancy, the brain starts to wire itself, forming connection. And in months after birth, over 1,000 to 10,000 new connections are made every second as the baby senses her environment. And sensory inputs leads to the neuronal network. So this is very important that baby receive the sensory inputs. And here you can see if child gets the stimulation, what is required, environmental stimulation and enrichment, then it enhances synaptogenesis. And if a child is deprived, it leads to small and less developed brains. So this is the brain science behind early child development. The preschool years are most important sensitive period for early brain development because all these sensory are developed during preschool years. 70% of the brain development occurs by age of 1 and 80% by age 3. And if this happens, if child is exposed to the proper stimuli, exposure to the language, touch or social interaction, emotional or cognitive attention, protection from physical threat, and adequate nutrition, everything is important. And nowadays, because of the better survival of premature and low birth weight, precious pregnancy and smaller families have brought early child development more into the focus. And now there are enough studies which clearly demonstrate the economic impact, how much it is important. And governments are also, that's why making it a aspirational tool, particularly in lower income countries. And that's why International Pediatric Association has prioritized early child development as one of its major thrusts and has a program area committee on early child development. So this has been already covered how everything has suffered during COVID, and that too also has affected the early ECD services, nutritional support because of lockdown, school closure, limited access to education, and to make the things worse, widespread increase in the screen time and online, limited outcome of options of online schooling has unknown consequences on child development and which will be felt for the many years to come. Now there are enough guidelines starting from Lancet in 2016 to Nurturing Care Framework in 2018, released by UNICEF, WHO, and others. And in 2020, WHO guideline on improving early child development. And this is the Nurturing Care Framework was launched at the time of 71st World Health Assembly in 2018. And nurturing care promotes physical, emotional, social, and cognitive development. And it produces lifelong intergenerational benefits. As someone said, there is an intergenerational poverty. So here there is an intergenerational benefit from the early child development, investing in early child development. And this framework outlines why efforts must begin in the earliest year from pregnancy to age 3 years, how nurturing care protects children from worst effects of adversity, and what caregivers need in order to provide nurturing care. And this is the intergenerational effect. You know how it goes from pregnancy and childbirth to older child and to the older person. So investing in the early child development has an intergenerational effect. Next, please. Go ahead. Next, please. Next, sorry, I covered some of these slides. Next, please. Next, next, next. Yeah, no, go, okay, go back, one slide back. Go back, still go back. Previous slide. Okay, go back. Can you go back on slides? Even more back. Hello, go back. Still go back. Go back more. I think one more. Yeah, so this is intergenerational effect of the this is nurturing care framework which was launched at 71st World Health Assembly. Yeah, go next slide please. Next. Yeah, so this is intergenerational effect of investing in the early child development. What you invest in one generation, it goes up to the even the next generations. Next, please. Yeah, so nurture this framework for nurturing care of ECD has 5 domains: good health, adequate nutrition, responsive caregiving, security and safety, and opportunities for early learning. And this responsive caregiving fits into the all other domains. And parents, families, and other primary caregivers are the main providers of the nurturing care. And the outcome is well-developed child. Health sector has major role from conception to 3 years. Next, please. Next slide. So this is a WHO guideline document which this responsive caregiving promote early learning, integrate caregiving and nutritional interventions. There is one more element here: support maternal mental health, which is here additional, and this is all are important. Responsive caregiving, promote early learning, integrate caregiving and nutritional intervention, and also we should not forget to support maternal mental health. Next slide. Next slide. So this is a WHO UNICEF training package which we have adopted in India, but this is available, which gives recommendation for caring of your young child development, and there are for the different age groups there is a guidance what should be done for the play, how to communicate. Next, please. So multi-sectoral interventions have an impact on brain development. You can see the different age groups. It is at every stage it affects the brain development, but also intervention throughout the life course, like parenting programs, mental health and well-being, social protection, water sanitation and hygiene. So all this, so this is ECD is where you need multi-sectoral intervention. Next, please. Next, yeah. So here are some of the effective interventions for health and nutrition. You can see the list here. What are the effective intervention which works for security and safety? This is neglected here, which includes social care, prevention of neglect, abuse and violence, responsive caregiving and early learning. You here again a list of effective interventions are listed. Next, please. Now, coming to the nurturing care in clinical practice, respectful care. This is what we can do in newborn. Good communication with mother and family, early skin to skin contact, pain management. There is a lot of work going on how these NICUs, neonatal intensive care units, the atmosphere there, noise level there, illumination, lighting, how that is affecting for the early child development and long-term effects. How we can involve more and more parents. So a lot of work is going on, and here you can also see what can be how you can do nurturing care in your clinical practice during child visits. Role of pediatrician is next, please. Role of pediatrician is very important. Point of there are different. The children come in contact with with pediatrician at many point of contact, and we should adopt a nurturing care for early child development in our own practice. We also should teach medical and nursing students, train the healthcare workers, advocacy with policy and decision makers, advocacy and parents and other stakeholders, public awareness and education. Pediatricians have access to every house, some from politician to policy makers. Everybody, every home is connected with one or other pediatrician, and we can definitely play a very important role in advocacy. Next, please. Now, these are the different touch points for ECD in healthcare where we can utilize this. It can be during clinical services, home visits, group sessions or child care centers, well baby clinics, newborn services, sick child visits. We can utilize all these touch points for ECD in healthcare. Next, please. Next. This is a exhaustive list of which I want to highlight that there are many opportunities where as pediatrician, as medical care professional, we can influence early child development and guide the parents and family and caregivers in how we can do that. Next, please. Empowering and engaging the family in clinical care. These are the some of the pictorial examples how it can be done, like playroom in pediatric ward, classroom, and next, please. Next, please. Role of pediatric society. We have very strong ALAPE, the Latin American Regional Pediatric Society, and more than 20 pediatric societies in Latin America. And definitely they can play a very important role in advocacy, collaborating with other sectors, sharing the success stories through the publication and position papers, capacity building of pediatrician, how they can sensitize and impart knowledge and skills to parents. And we have a very good program in India by Indian Academy of Pediatrics. Popularize the concept of well child visits at specific ages and prepare awareness material. Next, please. As the topic of this webinar, investing in early child development is upholding the child rights and build human capital and national development. Next, please. So here are the return to the human development investment across all ages. And you can see the best return for investment is in the preschool programs. Policymakers should invest in young children where the return on investment is stronger than in the low skilled adults. Next, please. So this is International Pediatric Association theme for 23-25, reaching every child. And now our leader Maria del Carmen has given the new slogan from 1,000 days to 1,000 weeks. So this is how we want to reach to the every child through our pediatric society and through our through the pediatrician. Next, please. Next. Yeah, these are the 6 strategic priorities where we want to increase the visibility of children. We want to enforce the pediatric workforce, and with partnership and with collaboration, better communication with parents, pediatrician, and everyone, and leadership and governance. Next, please. And we are very much, next please, we are very much willing to support ADN countries. What best we can do is to capacity building, dissemination, and advocacy. And this is also our focus area for collaboration with WHO. Next, please. Next. These are our guiding principles: collaboration and partnership, ethical guidelines, working together, community of practice, transparency. Next, please. I think that's the last slide of references. Next. Thank you so much, and sorry because of the technical issues. I was moving slides in my computer and could not follow up there. So thank you so much for the opportunity. I will try to remain present, but because of bad weather, maybe I have to leave in some time and reach home before it starts. There is a prediction of heavy rains here, and last week only we have flash floods, and before that 1 week we had cyclones. So there is a lot of anxiety here with the again prediction of rain. Thank you so much for this opportunity. Oh.
Muchísimas gracias, doctor Naveen Thacker. Una excelente presentación.
Thank you very much, Dr. Thacker. Excellent presentation. Dr. Thacker has been presenting on the situation of many countries, how 43% of the countries with low and medium income countries have their children at risk in not getting their full potential. He has explained about the science behind early child development, especially in the early childhood, and how this increases as the children grow and they start to feel and form their neuronal networks, and how important it is to receive the necessary stimuli in their setting to improve their synapses. He has mentioned that the 3 first years of life are the most important ones for their brain development, since 70% of this development is happens in the first year and 80% is in their first three. We have heard from Dr. Thacker what are the consequences of confinement during confinement and virtual school and school classes, and how important it is to invest in early childhood development to reach intergenerational effects. So he has also mentioned this conceptual framework of loving care, adequate nutrition, and the safety and security that is also needed. He has spoken about a training package that PAHO and UNICEF have prepared with different recommendations for development of small children in the different age groups. The play, how they communicate, and the importance of having them intervene with a multi-sectoral approach. Interesting what he has mentioned on the programs for parents, the interventions, and the how important is water and sanitation and hygiene. And he mentioned that these are important multi-sectoral approaches. Well, he has also mentioned the need to have interventions on safety and security, the prevention of violence and abuse, and also loving care with good communication with their moms and the families. And this kin-to-kin contact at the time of birth, and a good service from the NICU. And is mentioned how important it is to work as a pediatrician under this concept, different ages where the adoption of respectful care has to be implemented in the practice of pediatricians, and to include this in their professional training. He has also mentioned about the new home visit approach, group sessions, and the services which need to be provided to newborns and breastfed babies to support maternal breastfeeding. Well, there are actually different opportunities for professionals, and pediatricians can use these different alternatives to guide parents and the families to be more empowered, always involving the family. He said that we need to invest on this to build good human capital, and the return of investment at all ages will be important, but it will be much, well, the return will be much higher the sooner we invest. Thank you very much, Dr. Naveen Thakur. Great presentation. Hopefully, the weather will improve, and we would like to thank you for your efforts today with your excellent presentation. Thank you. Very well. Now, we would like to welcome now Dr. Cecilia Brainbauer, who will present on the role of health professionals in supporting families of children growing up in vulnerable situations that affect their development. Practical suggestions when time and resources are short. Dr. Brainbauer is a leading child and adolescent psychiatrist. She completed her medical studies at the Universidad de Chile, 1981-1989, residency in child and adolescent psychiatry at Hospital Roberto del Rio. Is holds a master's degree in public health with concentrated in maternal and child health from George Washington University in the U.S. She's also a member of the American Academy of Child and Adolescent Psychiatry and the International Society for Autism Research. She's a member of the advisory committee of the Global Group of Developmental Disabilities Research Collaborators, director of Inclusive Communities, a training initiative on up-to-date topics on autism, neurodiversity, and mental health from a rights-based approach for therapists, educators, and parents, generating local support networks. She is also an expert in child and adolescent development and developmental disabilities, advice director of the International Center for Health Systems Strengthening. She's an academic with a dual affiliation at the Department of Global Health and Department of Psychiatry, University of Washington, Seattle. She's been the executive director of the Interdisciplinary Council on Development and Learning Director, Development Launch and Implementation of the PhD program in Child Mental Health and Developmental Disorders of the International Council on Development and Learning at Fielding University, consultant for UNICEF in youth development and the Inter-American Development Bank, and she's been working in 3 Latin American countries, technical advisor of Pan American Health Organization, which is PAHO, regarding child and adolescent health, co-author of the book Jóvenes, Oportunidades y Cambios. Please go ahead, doctor. This is your space. Thank you very much, first of all, Maria del Carmen and Magda, for inviting me on behalf of the Andean Health Organization to this very important event. You have read all my whole curriculum, but the presentation for today, I just want to focus on the role of health professionals as a support to families of children growing up in vulnerable situations that affect their development. I will present this with images and I will give practical suggestions when time and resources are short. I imagine that in this audience, I hope there are many pediatricians, nurses, and many of whom work in this profession who, apart from this, are also mothers and fathers. And within this context, I don't know how many of you know Kino. He is the author of Mafalda. I've been reading Mafalda, and you see here the faces of both parents who are terrified and in angst when Mafalda says, well, anyway, we are the guinea pigs here. The parents are not taught how to deal with children, how to promote growth, and how to raise their kids. They learn from whatever happened with them as a child. And I very much loved the the event deals with promoting child development as a challenge for children's right. And within this context, I wanted to leave a question in developing child development. Should we focus on the child or the family? Clearly both, but how should we prioritize? And I want to issue an invitation to change the way we look at things. It has been historically placed on the child, and now I wanted to shift this and primarily put it in supporting families, mothers, fathers, and caregivers. Because in my experience of more than 30 years in working different places that Magda mentioned, is the most cost-effective way to support children's rights of all childhoods, I mean. I want to give you an example here of how to change the look. To the left side in red, I have taken the text of one of the goals in one of the technical health standards for the control of growth and development in children under 5 years of age in an X country. An X country because I've dealt with lots of guidelines of many Latin American countries, and they more or less say the same. When you see that the emphasis is put on the child, the boy or the girl, timely identify situations, and I quote, timely identify situations of risk or alterations in growth and development. If I speak like this to a mom or to a dad or a grandma or grandpa, they will start freaking out to identify situations of risk of alterations in growth and development for their effective attention, encouraging the active participation of the family and caregivers in the interventions to achieve normal development. And I would like to stop here. Historically, and I've been part of this movement, we thought that indeed you can have homework given to moms and dads. You basically find a way to support them from the health sector with motor skills, speech, and communication. And then you send homework to them. And this is using the families to participate, but this is actually a tool, and the ultimate goal is to achieve normal development. And this is something that I highlighted in red. With this change, the emphasis on the family, your technical standards should rephrase this. When you change the language, you will then see how the reactions of the moms and dads and the grandmas will change whenever they go to the pediatrician's office, irrespective of the reason why they are attending that appointment. My proposal is to quote, timely identify families of children growing up in vulnerable situations, and I will elaborate on this afterwards, that affect their development and provide cost-effective therapeutic support, access to preschool education, and regular accompaniment, healthy control, to achieve optimal development and mental health. Shifting normal development for optimal development and mental health. Maria del Carmen mentioned in her presentation optimal development and not normal development. And I would like to focus on these concepts that were part of the title of the presentation. When we identify things on a timely manner, as Dr. Thacker said, the first 3 years of life are very important. We have to identify families of children growing up in vulnerable situations. And we have environmental, where we know them as social determinants. Poverty, Dr. Givovich highlighted poverty mainly, and I totally agree that poverty is a very strong risk factor. We have poor education also, single parents, teenage parents who have to work and needed to quit school because they became pregnant very soon or because of the poverty. They needed to look after their siblings and quit school, and people with a very poor support network. I'm just mentioning some of these factors, but there are more. And on the side of biology, I will announce two big groups, preemies and developmental disabilities. And when I mentioned that the emphasis should be put into looking for feasible results, looking for optimum development, not normal development. In the world of people living with disabilities, we talk about support, three big categories of support: cost-effective therapeutic support, access to preschool education, and regular follow-up, like healthy controls. I think that this is very important in considering moms and dads' mental health. I will stop here for a while. I want you to give an example. This is a cost-effective example for families of children who are growing in vulnerable environments. So here's an example of a workshop that's called Nobody is Perfect. It has been imparted at large scale in Chile under the Chile Crece Contigo program. And this, as Dr. Gibovich mentioned, well, this was actually evaluated. You have the reference here. The publication has not become official. It's been accepted for publication, but I know all the authors and they shared the final manuscript with me. And this is an excellent research of this. Well, actually, this is an experimental evidence of a national scale intervention. They started following these families for 3 years with 2,916 families. This reached more than 150,000 families. The workshop started to be implemented in 2009 when Crece Contigo started in Chile. This workshop was adapted from the Canadian program. It's a workshop that lasts 6 to 8 weeks. They've been offering this workshop for more than 10 years, and they have helped a lot of people in Chile in different regions. The emphasis, I won't dwell here, but is promoting healthy parenting and mental health. Remember Mafalda, the cartoon? As Dr. Gibovich mentioned before, and Dr. Naveen Thakur mentioned, the issue of violent discipline interferes with development, and it is important to teach healthy parenting and promoting mental health of the mothers, the fathers, and the children, what we call the social and emotional index. This evaluation, which it showed, is that it had a sustained positive impact 3 years after the workshop. The workshop lasts 6 to 8 weeks, and this is outstanding. This is a randomized control trial. I don't remember what they got, but they compare this with two support situations. This is a basic concept of this workshop and how they adapted it from Canada, but they compare this also with a more intensive version where they added two sections where after having or making these decisions to gather these people somewhere and they started chatting on the content, and the fathers and mothers say, this week we want to prioritize here or there because we have these problems at home. These sessions were followed by two sessions with observations of the mother that participated in the workshop with their kid, showing how to implement whatever they learned in the workshop. This had a spectacular effect. In countries like Chile, with big inequalities, having the chance to see 3 years after what happened with this workshop, like the vocabulary index the social emotional index, and the executive function index. Well, this is a Canadian program. Whenever the nobody's perfect, when you are in the consultation room, hopefully you will print out these booklets. These are different brochures that were produced in Spanish by Canada. They are excellent. I'm a psychiatrist, and I think that the messages in each one of these pages could not be better. They are in Spanish, they are free. Please download them, print them out. And if you don't have money to print them out, keep them on your cell phone. Send the link to every mom and dad that you see, because if you don't have the Nobody's Perfect uh, workshop in your country, it doesn't matter. There's also a YouTube channel with short videos of this Nobody's Perfect workshop. Send these resources to the parents. Everyone has a cell phone. And this is the YouTube link, and this is the Nobody's Perfect HTTPS. And this deals with stress, with anger. Well, unfortunately, the Nobody's Perfect is not perfect. It's not been designed for children with this neurodivergent, if you will, development. This means children which have a development that is different from the norm. They won't ever be quote unquote normal. These are children who, well, unfortunately, the Nobody's Perfect model was based on evidence. When it was modeled, and this excludes these neurodivergent children. The exclusion criteria was children with severe developmental delays or developmental disabilities. When I asked why, they mentioned autism, intellectual disability, significant behavioral problems, which is basically those children who deregulate themselves. I don't remember who mentioned this issue of regulation. This is where we need to discuss biology, where there are vulnerable situations where the biology of the child will be different. Preemies, for instance. Preemies need to be followed up, and many of them could face a lot of developmental disabilities and biological risks, who won't stop being autistic or won't stop having Down syndrome. What these children need is support in the way they communicate, not only how to talk, because to speak or to talk, a deaf child will have a hard time in learning to talk. And in Chile, the way that they have tried to tackle this, nobody's perfect, it says that these children have to be referred. Referred where? Because there's no one to refer them. Even in Chile, they go to a neurologist, and they will be lost to follow up anyway. So I would like to highlight one of these things that we are doing. It's inclusive communal rooms, which is part of this program, which have been implemented with local communities. They have implemented 24 pilot rooms in 11 regions of Chile with a coverage as at 2023 with 4,500 children and their families approximately. But I would like to mention this because they are investing in training the therapists, that they are supporting these families with the most up to date. If they receive autistic children less than 4, and if you have an autistic child at 3 who's not talking, irrespective of the language therapy they will receive, they won't speak, but they need to receive different therapies. Some figures on autism and developmental disabilities, now that we are speaking about these topics. Chile carried out an autism prevalence study in 2021 that estimated 1 in 55 of 18 to 30 months of age, which is the 1 in 51 children. So with a projection, if you carried out the early diagnosis, you will see that there will be lots of autistic children. In Peru, I collaborated with my colleague Ernesto Reaño. He, well, we have the sources below. We have Chile and we have Peru. Ministry of Health in 2019, before the pandemic, identified that there were 15,625 autistic people, of whom 90.6% are under 11 years of age and 81% are male. Peru is not identifying girls, autistic girls, because the conservative prevalence is 4 to 1. And Ernesto carried out a projection of how many autistic people are to show the cap of not having early diagnosis. And I wondered why not project this based on Chile's prevalence, and there is a huge gap in the early identification. But even more so, I would like to move to the US because the CDC is carrying out monitoring activities of children and identifying what is the real prevalence of autistic children, and not only autistic children, but children who have multiple learning disabilities because of their biology. They know that these children, autistic children, and with other disabilities and difficulties, will have a hard time at school and then have a hard time in finding a job. Now, supporting the rights of all children is our idea. Thinking about this 17% having a developmental disability, we've also have these harmonic developments who will become children who will receive ADHD, executive function disorders, behavioral deregulation, and all of these are, well, I think that I'm running out of time. I would like to use my last 5 minutes in the practical suggestions, but we beware of the premise and the risk because we don't want to traumatize parents here. I wanted to stop here in these last 3 images. Let's switch gears. When you are in the healthy control, when you have a conversation with the parents, these 15, 20 minutes, 30 minutes, hopefully once a month, the first thing in our oath, this issue of no harm, not judging, not scaring, not stigmatizing. We have to be very careful with the risk of traumatizing and stigmatizing, as if it were bad being autistic, and we are stigmatizing all those moms who need early support to provide the best tools to their children to have a decent school experience and job experience. I have received lots of parents who are traumatized in the way they receive the diagnosis. Sometimes when you explain the do nots, you have to support the do's at each health contact. Talk about the early diagnosis and connecting to timely support. Always discussing if there are any disabilities and connect with timely support. And I will give you example. We have to follow these children once a month in the community, the pediatrician, the nurses, connect them to community networks. In the first session, you have to listen, to welcome, to empathize, and take time. I prepared this presentation with the help of the Atomic Moms. These are moms which are empowered. All of them have autistic children, and 80% of them have autistic children who do not speak. It's deep autism, but actually they have learned to communicate with them very well. So they asked me to add this sentence of listen, welcome, empathize, and take time. So if you find a child with these characteristics, listen, welcome, empathize, and take time. In the second session, you help them to visualize and validate the strengths of children and their mothers and parents. Yes, there's some difficulties in this area. Share what you will be doing and how to promote childhood development, and particularly this with autistic children. The next month, give examples of how to learn by enjoying daily interactions, and I will give you a resource in the next image. Next month, recommend technology support that will promote communication and learning with applications which could be used through the cell phones and tablets. In pediatrics, there's this idea that the screens are bad for children. They are bad if they are used alone. I mean, if there is no adult with them. But technology, support technology, could be very good for children who are disabled. It helps them learn and communicate. In the next session, meanwhile, there are 3-4 months that went by, and then you start working with the families and then connect them with support networks. And in every contact point, you send them to have a course on healthy parenting or a mental health course or regulation. So little by little. And I would like to close with this. These are Latin American resources made by Latin American people, almost all of them. So a fantastic book by Sergio Pérez Marcos from Uruguay. Inclusión temprana is for parents with any child with disabilities. So in Chile, we are using this every time we give a diagnosis of autism. When they are very, very little, we either advise them to read this book, and it is wonderful because the message is welcome to the world. You are autistic, okay, and you could feel proud of being autistic, and we will be with you all the way. And the third book is prepared by the Down Up, which is a precious guide for parents with children with Down syndrome. And the last suggestion is a course that is free for parents developed by Alexia Ratasi, who's an Argentinian colleague of mine. Basically, you have to go to the website, register, you don't pay anything, and you have a free course on supporting child development and transforming every day. Well, thank you very much. You are invited to visit our website, Comunidades Inclusivas, and the support network, because you have professionals in many countries to connect parents. Thank you. Thank you very much, Dr. Cecilia Bauer, for this very interesting presentation. Excellent presentation. You have presented today on a different approach, on a very interesting approach to deal
desarrollo
with
infantil
problems
temprano,
in early childhood
invitándonos a
development,
un cambio de paradigmas,
inviting
un
us to a
cambio en
change
esa
in the
mirada
paradigm, a
donde
change
usualmente
in
solo se ve al
this
niño
look
y
where
más
you
bien
only
brindándonos
focus on the child
un
and
cambio más bien
rather
en ese paradigma
providing
a ir hacia
a
las
change
familias para darles
towards
mayor apoyo, ¿no?
focusing on the
Lo cual
families to
será, nos ha
provide them
dicho
more
usted,
support
una intervención más costo
with
efectiva
a more cost
con
effective
un enfoque de
intervention
derechos en la infancia.
with
Nos ha brindado interesantes
a
ejemplos
different
que
approach. You have
podrían
provided
significar
interesting
cambios
examples
justamente en esos
which could
paradigmas,
mean
incluso en
changes
esas
in these
actividades que se
paradigms and even
plantean
in
en
the
las normas
activities
técnicas
of the
y que
technical
enfatice el
standards
apoyo
to
hacia los
emphasize
servicios
the
cuidadosos,
support given to the
sobre todo en
caregivers
aquellos
and
niños
families,
que crecen
especially
en
with those
situaciones
children
vulnerables,
who
¿no?
are
Para
growing in
este
vulnerable
desarrollo
situations
infantil y sobre
to
todo la
be
salud
able
mental.
to
Nos
work on
propone
their
usted cómo
mental health.
cambiar
You
ese
are
lenguaje,
proposing how to
no puede
change this
permitir cambiar
language
los
that will
mensajes, el
also change
cuidador, el
the
padre, la
message
madre
with the
tranquila
caregiver,
a
the
nuestros
mom
hijos.
or dad
Vamos
who
a los
comes to
consultorios
our
de los médicos,
office, to the
pediatras,
offices of the
enfermeras, enfermeros
pediatricians,
obstetras,
the
¿no?
nurses,
La importancia de esa
how
oportuna
important it
detección de
is to
familias con niños
detect
que tienen
children
en sus hogares creciendo en
who
esa situación de
are
vulnerabilidad
growing
y
in
conectarlos
vulnerability
con las
to
redes
connect
de
them with
apoyo
the
y protección.
support networks.
Nos ha hablado usted de
You
las
have also
intervenciones con
mentioned the
talleres,
interventions
actividades,
with
con promoción de
workshops
crianza
to the
saludable, con
moms and
salud mental,
dads,
demostrando que
focusing
nos
on
prueba que
mental
esto
health.
es
And
mucho más costo efectivo que las
all of this has proven to
visitas
be
que deben
more cost
realizar los
effective
hogares.
than the
Para cerrar el
usual
punto,
home
tenemos
visits. You have
la
highlighted
pobreza
the
y
importance
capacitarse en los
of
días de las madres como
the lack of
determinante
education as a
para
moms as an
fortalecer
important
para
factor
justamente poder
to
acrecentar los
be
problemas en
able
esta etapa.
to
Eh,
deal with
pues
the
nos
problems at
dice
this
el
stage. We
programa
have
de Crece Contigo, ¿no?
been
Donde nos
introduced to the
empieza a
Chile Crece
trabajar esta
Contigo program, where we have
expectativa
talked
de
about
nada
the
es perfecto,
workshop, the
¿no?
Nadie es
Reflexión
Perfecto,
también
nobody's
interesante
perfect,
con
and
seguimiento a los
in-depth
hazaños de 2.917
research
familias
of
y que
families
fue adaptada
that
por un
was
programa
adapted.
canadiense, ¿no?
Well, actually,
Donde
was
se
a
da
Canadian
la
program
importancia de la
where
promoción de la
they
crianza saludable,
promote
la disciplina
healthy parenting
violenta, cómo interfiere en el desarrollo y cómo se
and
interfiere justamente a través de este programa para
the
promover la
highlights
salud
of this
mental de
program
las
to
madres y
promote the
padres
mental
también.
health of these
Señor
moms and dads
secretario,
of these
realmente lo que
children.
usted nos ha conversado un
What you
impacto
have mentioned is that
increíble,
there
cómo
was
a
an
través de estos
important
3 años se han
impact,
dado resultados
how
muy positivos,
very
muy
positive results were
impactantes,
registered in these
efectivos,
past years. A
y
very
pues a
interesting
esos quiero
study. And you
contribuir,
also
¿no?
mentioned
Esta
that
educación
if
complementaria fue
the
diseñada,
Nobody's
no la hemos
Perfect
diseñado
program is not perfect, is
con
not being
desarrollo
designed for children with the
o
neurodivergent
sea, con retraso
problems, meaning severe
desarrollo,
delay
discapacidad,
or
discapacidad
disabilities and
intelectual,
so forth.
sin embargo, ha sido muy
However,
positivo
it's been
desarrollarse
actually
en los años.
very, very
En Chile
positive.
también hemos
In
estado trabajando
Chile, well, you
recientemente en
have
Perú, en el
showed
estudio de
figures
Perú,
of
¿no?
Chile, Peru,
Y nos ha hablado usted que es
and
importante
you have mentioned that
porque
it is
los
important in
estadísticos, la
Peru.
información
Well,
estadística
the autistic girls have not
sugiere
been identified. And
que
this
no
is something I find
es
very interesting.
importantísimo en cuanto
How
a
then it is
beneficiar
important as a
pues el
consequence of
empleo
this
del futuro
to
adulto
pay
que
attention
estamos
to
creando.
these
Cambiemos la
issues
mirada,
as
me dice
well.
usted, ¿no?
You
Pensemos en ese contexto
have
donde
urged
niñas,
us
cuando
to
cualquiera llega
change
a consultas de atención
the look,
primaria, pues en esos 20 o 30 minutos,
to take
¿no?
the most of
Nos ha
these
dicho
20
mucho
or
lo
30 minutes
importante, no hagamos
that
daño,
we
es
spend
cierto, es
in the
es algo
office.
que tenemos que
The
cuidar,
do no
no
harm,
maltratemos, no
both
enjuiciemos, no
not
estigmaticemos, ¿no?
judging, not stigmatizing
Al niño y a la
the
madre
child
con
and their
esta forma de
families
crianza,
and
¿no?
the way they are being raised,
Machista de ese niño como
the
problemático
autistic child or
y
someone
más bien tratemos de
with
acercarlo
disabilities and
a
try
justamente esas
to
redes de
get
apoyo,
them
a darle
closer
una
to
mayor
these support
oportunidad
networks
y que sepa qué
to
hacer, cómo
enable
ir
them to
buscando
have
esa
more
ayuda. Y es
opportunities, to
básico,
know
¿no? Lo que hablamos desde el inicio, ¿no? Para
where they can
justamente
find
poder
support. And this is something
captar
that we mentioned
los
from the very
procedimientos de apoyo
beginning,
cercano
because
a nuestra comunidad y
following them
sentirnos
closely
orgullosos
is
de
of the
esa calidad,
essence.
¿no?
Well, finally, you have also mentioned the technological support. And this is true. Many times we say no to technology for small children, toddlers, but if they are being joined by an adult, I think that the use of technology is very positive because it will allow better communication with them. Thank you very much, Dr. Cecilia Benbauer, for this excellent presentation. We have received questions and greetings. Please stay in the room because after the presentations, we will start with a Q&A. Right now, after the presentations, it is optimal to take some time and relax. The Horas Konu encourages the well-being of those who are joining us in this virtual session, and we will have an active pause for some minutes to combat stress, keep ourselves healthy, and keep our muscles flexible and healthy. Please go on.
Hola, hola, muy buenos días, muy buenas tardes, desde donde quiera que estés, bienvenido a este espacio desde el Organismo Andino de Salud Convenio Hipólito Unanue. Queremos brindarte un espacio saludable para salir de la rutina y hacer algo que nos pueda hacer bien a nuestras manos. Hoy con una herramienta muy sencilla, una pelotica de papel o una mediecita enrollada, cualquiera de las dos nos puede funcionar para poder hacer un cuidado de nuestras manos. El Horas Konu agradece a todos desde Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela para que hagan esta pausa activa y aprendan cómo podemos cuidar nuestras manos. Primer tipcito, lo más importante es tener la conciencia de ese autocuidado. Para eso vamos a iniciar con esa pelotica que tienes de papel, de enrolladita las medias, no hay ningún problema, y vamos a hacer un calentamiento para nuestras manos. Vamos a empezar a hacer chocolatico con nuestras manos suavemente, eso es. Vamos a ver cómo nuestros músculos se ejercitan y nuestras manos, que son nuestra fuente de trabajo, van a estar más saludables. Con la mano derecha vas a empezar a apretar y sueltas, aprietas y sueltas. Movimientos que ayudan para prevenir lesiones osteomusculares y, como no, también para divertirte. Cambio de manos, siempre lo hacemos con ambas manos para que puedan estar todas saludables, eso es. Hacemos presiones para que haya una fuerza sostenida. Muy bien. Los dos deditos que más se lesionan, el dedo índice y el dedo pulgar, vas a tomarlos con ellos y vas a hacer presiones sostenidas hacia esa mediecita, hacia esa hoja de papel. Lo haces con fuerza, o sea, como que es una presión sostenida que nos va a ayudar a trabajar los músculos de nuestras manos. Muy bien, excelente, perfecto. Palmas abiertas, subo los codos y voy a apretar con las manos abiertas, una fuerza sostenida. Eso es, vas a sentir el esfuerzo no solo en las manos, también en los brazos. Perfecto, y descansa. Nuevamente chocolatico, eso es. Y vamos a hacer un ejercicio dedito por dedito. Con cada dedito vas a oprimir esa mediecita, lo haces con el dedo índice, corazón, anular, meñique, pulgar y cambias de mano. Todos los deditos hacen el ejercicio con fuerza, eso es. Cada dedito hace el esfuerzo y sueltas. Mano derecha con la pelotica, mano izquierda va a sostener tu codo, listo, y vas a girar tu muñeca, listo. Cuando giras la muñeca hacia adentro vas a hacer presión, listo. Entonces presiono, abro, presiono, abro. Eso es, como que cuando gira la muñeca presiono fuerte. Tal vez pueda sentir un poquito de tensión, y es porque nuestras manos son un poco débiles, nuestra muñeca pueda tener mucha tensión, y por eso hay que ejercitarla, hacer fortalecimiento muscular. Cambiamos, recuerda, giro la muñeca, aprieto, giro la muñeca, aprieto. Puede doler más una manita que la otra, lo importante es hacer este ejercicio regularmente para que coja fuerza, tono muscular nuestras manos y evitar las famosas tendinitis, túnel carpiano, epicondilitis y una cantidad de enfermedades que se dan por ese uso repetitivo, por tensión acumulada y por cansancio. ¿Listo? Luego de hacer todos estos ejercicios de fortalecimiento, es importante también hacer un estiramiento. Entonces vas a entrelazar tus manitas y las vas a llevar al frente, vas a unir tus dedos índices con los pulgares, eso es. Ahora cambias, palmas mirando hacia ti, jalas una manito. Cada estiramiento lo puedes hacer un poquito más largo, haciendo unos 12 segundos, pero importante hacer estiramientos con tus manos. Yemita de los dedos juntos, hago como una casita, extiendo, 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 eso es. Muy bien, suelto. Por último, extiendo, meto deditos pulgares, empuño, giro las muñecas hacia abajo. Y con solo estos pequeños ejercicios, tus manos van a estar saludables, van a poder tener una mejor calidad de vida y a futuro ser una persona saludable. Desde Loras Conus agradecemos a todos los que hicieron hoy esta pausita activa, dándose la oportunidad de cuidar sus manos, que son su fuente de trabajo, y bueno, ¿por qué no también salir de la rutina? Muchas gracias a todos y excelente día o tarde. Chao, chao.
Bien, agradecemos a todas
Well,
las
we would like to
personas
thank
encargadas de los
all the
ministerios de
people
salud de la
from the
Academia
ministries of
y
health,
las
the academia, the
organizaciones
different
sociales
agencies and
de
social
Chile,
organizations
Argentina,
of
Belice,
Argentina,
Colombia,
Belize,
Chile,
Bolivia, Chile,
Colombia, Cuba,
Colombia, Cuba,
Ecuador, España,
Ecuador,
Estados
Spain,
Unidos,
the US,
Guatemala, Inglaterra,
Guatemala,
India,
the
México, Venezuela,
UK,
Paraguay,
India, Mexico,
Uruguay,
Paraguay,
Venezuela,
Uruguay,
entre otros.
Venezuela, among
Hemos
others.
recibido muchos
We have
saludos, los
received
cuales
lots of
agradecemos
greetings
profundamente.
that we thank
Para iniciar ya el
you
diálogo y a
for.
partir
To
de las
start
preguntas
and
formuladas,
kick off the
pido a
dialogue,
nuestros
I would
ponentes
like
por
to ask
favor
our
encender sus
speakers to
cámaras.
turn their
Durante
cameras.
el desarrollo de este
Throughout
webinar,
this
las
webinar,
ponentes y los participantes
the
han dejado algunas
participants have
inquietudes y haremos lo
asked some
posible por
questions,
dar
and
respuesta
we
a
would
la mayoría de
try
ellas.
to answer most,
Pregunta para el
if not all of
doctor
them.
Guillermo
Question
Gibovich.
for Dr. Gibovich.
¿Existe evidencia
Is
del
there
retraso
evidence
del
of
logro previsto de
the
desarrollo
of a
en los
delay in
niños
reaching
nacidos en pandemia?
milestones of
¿Se ha
children who
logrado
were born
algo
during the
desde el
pandemic? What
ámbito
to do
clínico y
from the
comunitario?
clinical and community standpoint?
Gracias por la pregunta. No,
Well,
lamentablemente en nuestra
thank you very
revisión
much.
no hemos
Unfortunately, in
encontrado
our review, we have not found
evidencias
this evidence
de los nacidos ante pandemia,
of newborns or people who were
pero
babies born throughout the
será
pandemic.
un desafío que
There
para la
is
sociedad recopilar información, sobre
there is
todo
actually something that we
iniciativas
need
de los países
to
que están
research more.
haciendo evaluación de desarrollo periódicamente. Vamos a buscar respecto a
We
desde el
will
punto de vista
actually
clínico. Yo
find out
dejaría
more,
la
but
pregunta
I would like to
al doctor
leave this question
Navin.
to Dr. Naveen. No, Dr. Naveen has left already. Dr. Naveen is not here anymore.
No, él se ha tenido que retirar para
Yes, we are
condiciones
sorry, but
climáticas
because of
en
the
su
weather
país.
conditions, he had to leave. We are very sorry for this.
Doctora Cecilia, no sé si
Dr.
quisiera
Cecilia,
complementar
I don't know if you would like to build on the answer given already. Yes, Dr. Gibovich, I was affected by the slide that you shared on the number of post-COVID orphans. This slide, I haven't seen this published, let alone in Spanish. Maybe it's in English, But this slide, I think that it is quite shocking, illustrating Latin American countries, the Latin American countries that you chose, because the impact of COVID, well, studies are being published. I haven't seen any focused in Latin America, and they are related to the language development mostly. This is what is usually measured, how many words are spoken. But when I see this, I wonder who's measuring the social economic aspect here. We know that historically, uh, orphans are equals orphanity equals trauma, and I've seen evidence in older kids. And during the pandemic, children who were living in families with family violence or violent discipline, where stress was actually very high during the confinement, and they did not have other spaces where to go. And this is mostly the factors that have been highlighted. Well, what to do, and something that we do not do every day. Start going from theory to practice. Even before the pandemic, all of these issues dealing with sensitive and loving parenting, this is still not implemented in practice. We keep on dealing with intrafamily stress and other issues, and we should take the practical suggestions I gave. But this is to all children, not only those living with disabilities. This is for everyone.
Muchas gracias, doctora
Yes,
Bomba.
thank you very much,
Ahora,
doctor.
pregunta para usted, doctora.
Question for you,
La
doctor.
pandemia o sindemia, si
The
nos vamos a un
pandemic
panorama más
or
amplio, ha
syndemic
incrementado la
has
exposición a
increased
eventos
the
adversos en la
exposure
infancia,
to
como el
adverse
alcoholismo,
events
el
like
abandono,
abuse,
la violencia,
abandonment,
¿no?
and
¿Qué
violence per
políticas
se. What
implementadas durante la
policies
pandemia
implemented
o
during the
intencionalmente
pandemic due to
dañarían la
COVID-19
estrategia
will
que
you
realizamos
highlight as
para la lucha
being
contra estos
significant
problemas?
in the
¿Qué
fight against these
recomendaciones
problems,
daría para
and what
mayor claridad y
recommendations would you
respuesta?
give for the bettering of these policies? Well, this is actually an answer that I need to think. I do not work on public policies every day in, day out. I basically work on supporting and mentoring people who work in the trenches with direct contact, moms and dads and psychologists in different things. So taking this up to policies is not easy, but one of the things that the pandemic showed is, and once again, I go back to the screens. Before COVID, I was using Zoom from the moment Zoom was invented, but the American Academy of Pediatrics historically has issued very strong recommendations in avoiding the use of screens. And with COVID, they had to become more flexible in these recommendations because there are many parents who, to keep the l- link with their children, because you know that this is a matter of having good relationships, lowering stress within the family, and you need to keep and preserve the link. So this is why we're having parents and mothers and fathers post-COVID who are striving to keep the link, and the WhatsApp video, sending a video, connecting, and having these daily interactions is about thinking out of the box. And one of the things that I saw in COVID is the use of technology in supporting moms. The Zoom meetings are direct and right at the moment, but the WhatsApp groups work differently as support networks. I remember that someone shared a study where they were doing exactly this post-COVID. And this has to do with healthy parenting. And I think that this is something to rescue things that moms and dads can have at their avail and do all the things that they need to do all the time, apart from feeding their babies, protect their babies, and promoting. So I think that we have to change things from theory to practice.
Muchísimas gracias, doctora
Well,
Brenbauer.
thank you very much, Dr. Benwauer, for your answer.
Pregunta para el
Well,
doctor
question
Guillermo
for
Guibovich.
Dr. Guillermo
Los
Gibovich.
indicadores de seguimiento,
The
monitoring
follow-up,
y
monitoring, and evaluation indicators in early childhood development do they allow for adequate measurement? Do they allow for international comparisons? What are the recommendations that you could share, please?
Definitivamente que sí permiten
Well, definitely they allow if we have a certain level of standardization.
Si nos basamos o nos
If
guiamos
we
por el marco conceptual
if
que hemos
we
llamado cariñoso y
think
diferente,
about
también presentado por
the
Dr. Narim,
conceptual framework presented by
ellos
Dr.
indicadores
Nadim as
perfectos
well,
para hacer
the
seguimiento.
indicators
Todos son
to
perfectamente
for follow-up, they are all
compatibles.
perfectly
Los de salud nutricional en
attainable.
algunos
The health and nutrition
países
might be obtained by the Andean countries right now, but where we have difficulties is
a cuidado, a seguridad,
in
a aprendizaje
care,
temprano, el
safety,
deporte,
early
las diferentes
learning,
definiciones
because of the
que
different
nosotros podemos hacer,
definitions
pero también es
that we
cierto
have in
que
the countries. But as I
queda mucho
mentioned
por hacer
already,
y
there's a lot
con
of
la
work
nueva
to do,
iniciativa que tiene
and
Dios
there are new
en
initiatives
Argentina, yo creo que vamos a poder
for new
hacer un tamizaje, una
policies.
selección
And I
de
think that
indicadores
in this way we can have a good
país
screening and
diferente. Si
selection.
bien no el indicador exacto, pero de repente indicadores proxy para medir este desarrollo y hacer compararnos.
Gracias, doctor Guibovich.
Thank you very much, Dr. Gibovich. Question for Dr. Brembauer.
Pese a las intervenciones,
Despite the interventions, there is a persistence and increase in the gaps in reaching protection and morbidity and mortality stemming from the COVID-19. What do we need to rescue from the lessons of the pandemic to design adequate answers for future pandemics? As the experts say, we have to see what's been in our advantage during this pandemic. So, because waiting for evidence, you know that studies take a long time, and there's a space to think out of the box where there's evidence that even if the papers are not published, we could be like preparing for the next pandemic and have a checklist already prepared. So I wanted to extend on the last question about how to compare between countries, because having indicators has always been a problem. This is historical. I worked at PAHO for 2001, 2005, and I remember when Pepe Solari, the doctor, I was invited to conduct research in 3 countries, and Chile was one of these countries, to develop an indicator through populational surveys. And they used this data to develop Chile Crece Contigo. The instrument is different from UNICEF. And we didn't know about this confusion. And more than perfectioning the means to compare, I think that we have to see about the Sustainable Development Goals. The only indicator that could somehow capture development was 4.2.1. And basically, children under 5, I don't remember the exact reaction, but it was about having an optimal development for school. And there was no way of measuring this. We try to measure these 2 to 5 years, and Dr. Thacker has emphasized on the importance of the first 3 years. So instead of seeing what's the goal, because the goal is that they are ready for school, because they will receive children who won't have a normal development. They will keep on receiving 17% of children per month who will be atypical, neurodivergent, and you call it, and have the right to go to school. Yes, thank you very much, doctor, for your reply. Question for Dr. Givovich. Do you allow, children are allowed to get married starting when they are 14. So what about this law? What could you say? What could you tell the Congress members who will be those who will make decisions to this regard? What risk factors?
La recomendación que diría es que la tomen con calma, o sea,
Well, to keep calm, why rush into this, into modifying? Well, we know that the consequences of fertility in adolescents, it is, well, you know how difficult this is, and teenage moms cannot then continue going to school, and let alone have raise their kids. We know that there are lots of risks of prematurity. There are many, many risks. Maybe Dr. Brainbauer has much to add. I don't think decision makers will be happy. I would tell them, if your daughter got pregnant by 14, would you want her to get married, or would you be willing to support her without? Because unfortunately, girls, when they become pregnant at that age, it is not because they didn't use contraceptive methods. Most of the time is either because they have not been taught sex education, or either because they've been pressed and they had intercourse without protection at a young age. And many times what marriage does is protect this gap. So thinking about your daughters, their daughters, and unfortunately, there are lots of factors that are contributing to early pregnancy.
Muchas gracias. Una última pregunta para la doctora.
Well, thank you very much. What applications, talking about screens, could be advised for children under 5? Well, I can share the links afterwards. I am thinking about Chile, but I know that this is also true in Spain, in Argentina, which are made by people who work in early education. And this is free and highly didactical, and the parents can benefit from this. Thank you very much for the question, because as this, well, there were some links on PDF, and I can share some more to share. Yes, thank you, because we want to disseminate this among our participants. Well, thank you very much. We thank you for the questions. We didn't manage to answer them all, but we will take them into account to define the issue, the subject matter of the next web seminars. We treasure your interest, and to close this space, I would like to ask you to leave a final message. Well, unfortunately, Dr. Thacker left because of the time and the weather, and Dr. Guillermo Gibovich, then the floor is yours now for your last message. Thank you very much. I would like to mention that we still have much to do. We have gotten better, but there's still a lot. And I have presented national averages. If we bring this down to a subnational level, I think that it could be alarming. So we have to measure not only the average, but we have to measure how unequal we are if we compare ourselves with someone else. Thank you. Thank you very much, Dr. Cecilia. Magda, when you contacted me on behalf of María del Carmen to give this presentation, you asked me to present intergenerational transmission. Now, thinking about this 17% of children who will never develop themselves normally or typically, how could someone feel when they grow differently? The percentage is much higher. It's like parents are ashamed of who they are, or because they didn't learn well writing or math, and this is something that they will convey to their children. So this is the truth. We have to convey this to our children, and we hope that they could grow with their interests, which are valid. And this is something that their parents need to validate as well, and have them think what are their strengths and what they can receive from the positive side. Well, thank you very much, Dr. Brembauer. Once again, I would like to thank our presenters of today. Excellent final messages, very moving and quite encouraging. We have received a lot of messages in our networks. Once again, to all of you, to the participants, to the Horas Conu team, and all of the people who were present in this activity, thanks to the commitment with Latin American integration. I would like to hand the mic to Dr. Calle for the closing of this webinar on behalf of the Orozco. Orozco. Dr. Calle, the floor is yours. Well, thank you very much. Thank you very much, Guillermo, Cecilia. I have sent a message to Naveen to thank him. Thank you very much for your time. You know that this issue is actually something old. This is not new. We've been working on this for a long time, actually, and I have to tell you, Cecilia, that the Andean countries, which are part of our organization, are Bolivia, Chile, Colombia, Ecuador, Peru, and Venezuela, and there are different levels of development. If you consider and take this area, there are more advanced groups, there are less advanced groups, but the pandemic has affected everyone. If there are studies or there aren't studies, well, there are pretty many studies, studies in developed countries, and as you have well put it, what they evaluate is the language skills. This is what they mostly evaluate, and then forget about the, the rest. This is well, actually progress. The other issue that I wanted to dwell on is that it is important to have data, and what Guillermo has said is important to have broken down data, not averages, because averages are hiding the reality, and more so in heterogeneous countries like ours. I'm not saying that we have the coast, the jungle, and the highlands. We have different ethnical groups. We have different realities, and things are different. I I like to talk about childhoods in plural. Social determinants have to be considered as well. And you are who you are. It's your genes, the environment, and definitely early childhood development is recognized as is one of these determining factors for physical and emotional health and for everything. We started talking in these terms 20 years ago, and this is something that Guillermo mentioned. This is still being mentioned, but with a different name. We did been doing this from before, and I very much like something that you mentioned from my perspective. And this is very much related to what we do at the Orasconu. We believe in rights. Every person, irrespective of their characteristics, of where they come from, or their skills, or you name it, has the right to the higher health level and welfare and the right to a dignified life. And this is not negotiable. I don't know how we could put it. This is the motto of the Oras Konu. This is part of our DNA. And then the inequalities are also important. Guillermo has discussed poverty, among other things, and he's been blunt because he compared us with Norway. And sometimes this is something that people ask. Why are you comparing ourselves with developed countries? But this is good. Everyone has a right. Neurodivergent, normal, coming from different ethnic groups, people with different skills, well, you name it. And of course, neurodivergent children need more support. I'm a pediatrician. I've been a pediatrician for a long time, and the most important thing I always tell parents is it is not about loving them. It is also about accepting them. This is the hardest thing because you have a preconceived idea as to how your child will turn, and then you have someone else. But this is, we are changing. We are changing, and I feel that we've been moving forward a little bit. And because you know that this is not about having professionals who we know how to deal with this. We need professionals who will respect children. So this is something that the Peruvian Association of Pediatrics has always said. Well,
Nosotros estamos publicando, no me acuerdo, creo que la próxima semana.
I don't know. Well, I think that next week we will have this publication issued as part of a study that was conducted and this thing that we have included in our discussions, and that this is something more.
¿No? Porque lo que ha presentado Guillermo es súper interesante.
What Guillermo has presented is different. Well, it's very interesting. When I had the meetings with the countries, I almost said, I think that Bolivia has more, but it doesn't matter who has more. The specific things is that we have lots of children in these countries who need differentiated support.
Salud mental ya inició toda una intervención. Justo hoy día tenemos a las 2:30 reunión con la directora de salud mental en Perú. Pero falta mucho, pues, falta muchísimo. El otro tema que me llamó, el embarazo adolescente, el matrimonio infantil. No debe haber, pues, no podemos permitir que nuestras leyes lo permitan. No puede ser, no es, por Dios, y Guillermo dio un montón de razones. No solamente es la chica, es el niño que sale en peores condiciones, pero lo más triste es que nosotros estamos chequeando la edad de los chicos, de los papás, de las mamás de niños de 10 a 14 años. Y nos estamos encontrando con la novedad que un porcentaje importantísimo son menores de 18. Quiere decir, estamos haciendo las cosas mal, pues. Definitivo. No estamos cumpliendo con digamos, lo triple, ¿no? No estamos teniendo educación sexual, no estamos teniendo acceso a anticonceptivos y no estamos dando oportunidades. Entonces, ni qué decir, pues, hay mucho por hacer, como dice Guillermo. Me ha encantado este webinar, todo lo que ha dicho también Navin ha sido súper interesante. Nos han acompañado médicos, enfermeras y gente que está dedicada al asunto, y definitivamente desarrollo infantil temprano, y por eso lo repetimos, óptimo desarrollo infantil temprano, óptimo, es un determinante, y seguiremos trabajando muy fuerte para que en los países de nuestra influencia se tomen todas las medidas. La idea es que nadie se quede atrás. ¿Qué significa eso? No solamente que nadie se quede atrás en las poblaciones, sino que nadie se quede atrás en los ministerios. Si hay un ministerio que ya hizo, ya probó y le fue bien, se comparte. Y este es un trabajo que estamos haciendo muy fuertemente en los últimos años. Bueno, muchísimas gracias por su presencia. Gracias, Cecilia. Gracias, Guillermo. Gracias, Navin. Gracias, Magda, por toda la articulación. Gracias a todos los del Organismo Andino de Salud que han hecho posible el webinar número 179 sin interrupción hace 3 años porque estamos totalmente convencidos de que la información es importante. Tú respetas lo que tú conoces. Y yo creo que en el caso de niños especiales o llámenle como le llamen, si tú conoces cómo es, respetas a ese niño y lo ayudas. ¿Sí? Así que es parte del trabajo que hacemos. El próximo jueves tenemos el siguiente webinar. Vamos a hablar de mortalidad materna, ¿no? Que sabemos que todavía es un problema de salud pública pendiente. Muchísimas gracias, buenos días, buenas tardes, nos vemos pronto. Gracias.